Imagine waking up one morning, months after you've supposedly recovered from a viral infection, only to find that your body doesn't seem to agree with the word recovered. The fatigue that once signaled the tail end of a bad flu has now become your constant companion. Simple tasks, climbing the stairs, carrying groceries, leave you breathless, as if you've aged decades in a matter of weeks. This is the reality for millions around the world who are grappling with long COVID, a mysterious condition that has left even the brightest medical minds searching for answers. Long COVID, or post-acute sequelae of SARS-CoV-2 infection (PSC), isn't just a lingering cough or occasional headache. It's a complex, multifaceted syndrome, manifesting with symptoms that can range from chronic pain and debilitating fatigue to cognitive disturbances, often referred to as brain fog. What makes it even more challenging is its unpredictability. Some patients develop symptoms weeks after the initial infection, while others might not experience issues until months later. Let's take a closer look at the pain that often haunts long COVID sufferers. Unlike the acute pain from an injury, this pain is more insidious, often described as a deep, persistent ache that can flare up without warning. Recent studies suggest that this pain may be linked to the way the virus interacts with the nervous system, possibly triggering chronic inflammation or even damaging nerve fibers. Imagine living with a pain that doesn't just hurt but also refuses to be clearly understood. Neurological issues are another daunting aspect of long COVID. The brain fog, characterized by memory problems, difficulty concentrating, and an overwhelming sense of mental fatigue, can be particularly distressing. This isn't just about forgetting where you put your keys, it's about struggling to find words in the middle of a conversation or feeling lost in a familiar place. Recent research has shown that these symptoms could be due to microclots in the brain or persistent immune activation, but the exact mechanisms remain elusive. Treatment, for now, is largely symptomatic. Physicians often recommend a multidisciplinary approach, combining physical therapy, pain management, and cognitive rehabilitation. There's also growing interest in the role of lifestyle interventions, such as diet and exercise, in managing symptoms. However, the unpredictability of the condition means that what works for one person may not work for another. So, what can be done to help those suffering from long COVID? Firstly, awareness is key. As more people recognize the signs and symptoms, we can foster a better understanding of the condition and reduce the stigma that often accompanies invisible illnesses. Secondly, continued research is crucial. Scientists are making strides in understanding the underlying mechanisms of long COVID, but there's still a long way to go. And lastly, a message to those who are affected: you're not alone. While the journey to recovery may be long and uncertain, every new study and every shared story brings us one step closer to finding answers. In the meantime, it's important to listen to your body. If you're experiencing symptoms that don't seem to go away, don't dismiss them as just part of getting older or being out of shape. Seek medical advice, advocate for your health, and remember that recovery is not a race. It's okay to take things one day at a time. As we continue to navigate this uncharted territory, let's not forget the lessons we've learned so far. Long COVID has shown us the importance of resilience, the power of community, and the need for compassion in the face of uncertainty. And while we may not have all the answers yet, one thing is certain: every step forward brings hope for those living with long COVID.